India reports a steady rise in COVID-19 cases, hospitals across the country are holding a mock drill today to assess the COVID preparedness. The nation has seen the daily spike in cases jump from a little over 3,000 on the 30th of March up to as high as 6,155 on the 8th of April. While the number was slightly better on the 9th of April at 5,300, India cannot afford to let its guard down. Some of the states reporting a relatively high caseload include Kerala with over 11,000 active cases and similarly with Delhi as well with a little over 2,000. With the numbers now steadily rising in multiple states, the centre and the state governments have rushed into action. The government has made wearing face masks mandatory in public places in Haryana as well as in schools as a precautionary measure. Let's go across to my colleague Dharani, who is joining us live from Chennai on the mock drills that are currently taking place to ensure the preparedness. Dharani, what's happening there?
The primary healthcare centers, regional and district government hospitals and also private hospitals in Tamil Nadu, they are carrying out this COVID mock drill, today and tomorrow. In fact, right now I'm standing in Rajiv Gandhi Government Hospital here in Chennai, and a few moments back, this hospital had its share of the mock drill. Health Minister Mansukh Mandaviya inspected the mock drill here, and during the mock drill, the preparedness in terms of equipment and manpower was checked, and the Health Minister seems to be satisfied, with the facilities here. In fact, talking about numbers, Tamil Nadu has been reporting over 300 daily positive cases for the past 3 days. Until a month back the number was less than 20, but in the past 3 days the number has very well crossed 300, and the state government is doing everything in its power to curb further spread. Right now I'm being joined by Rajiv Gandhi Government Hospital Dean Dr. Therani Rajan, and we'll put forward some 2 quick questions to him. Sir, what kind of instructions have you received from the state government to curb further spread, because evidently the cases are spreading in a very rapid manner?
Actually, we have received a communication from our respected health secretary. He has asked us to check the drug position as well as the PPE kit position and oxygen capacity and wards. In the wards, they have asked us to keep ICU beds along with oxygen beds plus non-oxygenated beds. Almost we have 150 beds in our rheumatology block. Right now we have only 7 patients, out of which only 2 patients are requiring, one is ventilator and another one is a CPAP. Remaining patients are on room air. So that is the current scenario in IP. And we got a capacity to check for RT-PCR for 500 patients. RT-PCR is done 24/7 in our hospital. So along with that, we have sensitized our doctors about this XBB 1.16. This is the recombinant virus of XBB 2.275 along with the XBB 1.101. So this virus actually producing only mild flu-like symptoms like fever, cough, sore throat and body ache and other things. And patients with comorbid uncontrolled diabetes or cancer patients, when they get this infection, it's become an incidental COVID. The virus per se is not causing any lung issues as well, because once the patient gets low saturation, we have been asked to check the RT-PCR as well.
Okay, so definitely the doctors to be well prepared. Dharani, stay on with us. Let's also take an update from Delhi. Mayank also joining us on the broadcast of what's happening in the national capital. Mayank, have the mock drills begun?
Well, see, in some of the hospitals in the national capital, the mock drill will be tomorrow, but today it was scheduled to take place in AIIMS Jhajjar, where we are currently reporting from. The Health Minister Mansukh Mandaviya was scheduled to come here to monitor the mock drill, but he could not come here due to some, unavoidable reasons. So mock drill, is has started, and here some top officials of the AIIMS Delhi has come here in the AIIMS Jhajjar. The doctors you see on your screen, they have come from AIIMS New Delhi to monitor this mock drill. On your frame is M. Srinivas, the chief of the AIIMS New Delhi, and they are here to oversee this mock process here in AIIMS Jhajjar. So the mock drill has started, and there are multiple grades of patients who come here with COVID-19. So different of management of COVID-19 will be going through the mock drill. Even the oxygen cylinders have been kept here. Some of the beds are kept here with this oxygen mask you can see on your screen, and also the oximeter to for the dummy patients to go through this COVID-19 mock drill.
Okay. So in fact, Haryana is also one of the states that has made mask wearing compulsory again. Mayank, we'll continue coming back to you for those updates on the mock drills. Tharani, thanking you as well.